Let's move on to the trematodes. So the trematodicidal agents are, the prototypical one is praziquantel. It increases the membrane permeability to calcium of the organism, which results in a marked contraction of the trematode and then paralysis. It's used in trematode and cestode infections, and it is the drug of choice in schistosomiasis. It's an alternative to albendazole in systemic cysticercosis, or the pork tapeworm, and it is contraindicated in ocular cysticercosis. So ocular cysticercosis you must treat with albendazole. So here's an example of ocular cysticercosis, or pork tapeworm. I'm going to say pork tapeworm because it's easier to say. So I'm going to say it again and again. Pork tapeworm, ocular, treat with albendazole. Systemic, you can use praziquantel. In terms of the mechanism of action of praziquantel, it increases the membrane permeability to calcium as well, and it causes the marked contraction and then paralysis of the agent. Toxicity includes headache, dizziness, and drowsiness. Let's move on to the cestodes. So the cesticidal agents are quite varied. I think I'll talk quickly about nicolosamide. So nicolosamide is interesting because it works differently than the other agents. It uncouples oxidative phosphorylation. This causes paralysis of the organisms, and it activates ATPases in the tapeworm. It is an alternative drug in beef, pork, and fish tapeworms, but it is not useful in systemic cysticercosis or pork tapeworm cysts. Now, here is an image of cystic cysticercosis. You can see the cysts present in the liver on the CT scan, and it is pointed out to you with a white arrow. The ova and larva are not killed by nicolosamide. Use albendazole in the cyst form of pork tapeworm. In terms of the toxicity of nicolosamide, gastrointestinal distress, headache, rash, and fever.